Hi, ladies and gentlemen. I'm Dr. Arthur Benjamin. I'm a board-certified ophthalmologist specializing in premium cataract and laser vision correction surgery. We also treat dry eyes. So today we have a very interesting guest. This is a gentleman who came to see me about a year ago with a desire to see better. On examination, we saw, yes, he did have cataracts in both eyes, but more importantly, there was significant corneal scar, apparently a result of an infection that was induced by contact lens during a trip to Mexico, etc. So as a sequel of this remote infection, there was a dense corneal scar. Rather than jumping in and doing cataract surgery, expecting a very marginal result in that circumstance, we decided to treat the corneal scar with a very new, novel technique of using drops of a medication that's been around for decades called Losartan. Solution of this medicine is applied 3 to 4 times a day for a period of about 4 to 6 months, and that helps the resolution of scars. We did this, and about a year later, Tom came in, the scar was completely cleared, and we decided to take a plunge and perform cataract surgery with the best and the latest generation of multifocal lenses. At this time, it's Envy from Bausch Lomb, toric lens that corrects astigmatism, farsightedness, nearsightedness, everything and everywhere in between. So I want to thank Tom for trusting me to make this decision, and I'm gonna let him talk about his experience, and hopefully many of you will find this helpful.
I feel like an extremely lucky man to have met Dr. Benjamin. I came to him because I had a very nasty eye infection that had caused scarring of my cornea. And I got an improper diagnosis from the first eye doctor I went to, and then a few weeks later I wanted a second opinion, and that eye doctor told me that I had a corneal ulcer and scarring on the surface of my cornea, and it was permanent. I wasn't blind, but this was a big loss to me. A friend of mine recommended I see Dr. Benjamin. I thought, well, why do I need a third opinion? What more is he going to tell me? Well, he knocked my socks off. Unlike most doctors I've seen, he immediately came across as somebody who cares genuinely, and he eventually referred me to another eye doctor who does corneal transplants, and that might be the result that I would have. It turns out that there is a brand new treatment that his colleague knew about called Losartan. It's a blood pressure medication taken as a drop or as a pill for blood pressure, but there's a new treatment using it as an eye drop to heal corneal scars. And it turned out to be a miracle for me. The cloudiness has resolved. I don't have cloudy vision anymore in my right eye, and my eyesight improved over the course of this. And Dr. Benjamin could perform cataract surgery that I now can see without glasses, and maybe never have to wear glasses for the rest of my life. So I've had an excellent experience with Dr. Benjamin, who fortunately knew enough to explore new technologies and help me assess what were the pros and cons at each step. I'd also like to add that Dr. Benjamin is a remarkable person. He shows great care and does not condescend. He's treated me as an equal and clearly explained what my options are and what my situation is. Patiently responds to my questions. He has an excellent staff, highly trained, competent, and I feel, as I said, like the luckiest guy in the world to have had this great fortune to work with Dr. Benjamin, because instead of having permanently impaired vision in my right eye for the rest of my life, I can see without glasses clearly, and prognosis is excellent. I can't be happier.